Welcome to the February 26th Rapid Update in Therapeutic News. I'm Tessa Lewis. I'm a GP with interest in therapeutics and care of older people. I want to highlight the British Geriatric Society Pragmatic Prescribing document, touch on the antimicrobial utilisation and resistance report, and genomics. In the July AWTTC Rapid Therapeutic Update, we highlighted resources to support us managing the complexity of multiple medications, and particularly the Royal College of Physicians Toolkit and the AWMSG Polypharmacy Guide, and that's still available on the AWTTC website, Learning at Lunch website. But we do have a real challenge with people who are living with frailty. It can be difficult to know where we stand if we suspect certain medicines might be causing more harm than good, and to know at what level of disease control we should be aiming for. We know we have support from the CMO document 2023 highlighting that improving quality of life in older age sometimes means less medicines, not more, but often those decisions aren't clear-cut. Several regions have developed local guidance for targets for things such as blood pressure and glycemic control. But we now have this nationally agreed 2-page summary document from the British Geriatric Society to support our decisions. So I don't expect you to be able to see the details on this slide, but the British Geriatric Society collaborated with other organisations to develop this short guideline, including the Royal College of Physicians, the Royal Pharmaceutical Society and the Royal College of GPs, and NICE has confirmed that it's consistent with their guidance. So this is page 1, and on the second page there's resources and references and rationale. So looking at the detail, in people with moderate frailty, so that's people who need some help with some aspects of personal care, they might struggle with stairs or no longer be able to go out alone. The aim here of treatment is shared decision making to establish the person's goals and priorities, and the advice is that more lenient therapeutic targets might be better to balance the medication benefits and harms. So here for hypertension, it reminds us to use more lenient targets, and when measuring for postural drop, so from lying or sitting to standing, base the prescribing decisions on the lower value. And there's a suggested relaxation for the HbA1c targets to 60 to 75, and in heart failure with reduced ejection fraction, limiting prescribing to fewer than the 4 pillars might be a better balance of risks and benefits. And the gut summary also includes advice for osteoporosis and cognitive impairment. And so somebody who needs help with all their personal care or receiving palliative care, who have severe frailty on the Rockwood scale, our priority should be symptom control. Moving on now to the antimicrobial utilisation and resistance report, which publishes annually. The key messages here: we've seen continued sustained improvement in the prescribing of 5-day rather than 7-day courses of antibiotics for respiratory tract infections, and that's been national guidance for quite some time. And we've also seen continued reduction of the 4C antibiotics, coamoxiclav, cephalosporins, clindamycin and fluoroquinolones. So hopefully that will reduce the risk of antimicrobial resistance and adverse effects. But appropriate use of antibiotics still remains really essential. We're still seeing increasing rates of Clostridium difficile infections. In Wales, overall, there's been a 22.5% increase in cases, with similar increases seen in both hospital onset and community onset. So, and antimicrobial resistance remains a very real concern. Over the past year, there's been an increase in the overall rates of bloodstream infections, bacteremia, with a 9.3% increase in the rate of antibiotic-resistant bloodstream infections from the previous year. These resistance infections also disproportionately affect people from more deprived communities, where the antibiotic-resistant bloodstream infection rate in the most deprived quintile is 47% higher than in the least deprived quintile. E. coli now accounts for 70% of our resistant bacteremias, and therefore these will often be associated with urinary tract infections. So it's a really powerful message for us to get the management of suspected urinary tract infections right, and being careful about diagnosis, checking if somebody's got a recurrent UTI. As in the Welsh Government improvement goals, the CMO and Chief Nursing Officer remind us to use antibiotic-sparing approaches, particularly for recurrent urinary tract infections. The good news is that lab urine samples continue to show a low rate of resistance, E. coli resistance to nitrofurantoin at 2%, and that stayed the same over the last 5 years. We talked about methenamine in the Learning at Lunch webinar in February 2025, and in terms of other things that we can do, in the Learning at Lunch February 2024 webinar, You're in Good Hands by Avril and myself, we talked about the feedback and practice tips from the QAIF, the UTI Quality Improvement Scheme work that we all did some years ago. So what else can we do? Just it's worth a visit to the RCGP Target Toolkit. They've updated their patient information leaflets. The infection summary is on there, and they have webinars. Make sure your team's got an antimicrobial stewardship lead. Talk to your colleagues about backup prescribing, and remind patients that viral infections aren't helped by antibiotics, and antibiotics can cause side effects and resistance. And finally, I just want to touch on pharmacogenomics, which is very definitely with us, and as you can see by this BNF updated dosing instructions. NICE have published guidance regarding the use of genotype testing in guiding prescription of clopidogrel, and that's particularly for people with acute stroke and TIA. So I suppose for us in primary care, what are we meant to do? What do we do with this genotype testing? The RCGP have worked with stakeholders and have produced some information to support prescribers who are outside of the acute stroke setting. And they've also done guidance on direct-to-consumer genomic testing. So currently, there's a recognition there's a lack of general UK guidance for prescribers, but some helpful resources there. So thank you very much for listening. In summary, you and your team can support antimicrobial stewardship, and do have a look at the British Geriatric Society Pragmatic Prescribing document. I find it very helpful. Thank you.